Hi, I'm Dr. Lindsay Doe, clinical sexologist and host of this sex-curious show, Sexplanations. This week, I got my teeth cleaned. It was once asserted by TikTok dentist Dr. Husafa Kapadia that you can tell from looking at someone's mouth if they have given a blowjob. Fun! Let's unpack that. I'm curious. I called my dear friend Dr. Mark Rigby, a doctor of medicine in dentistry, a dentist, and asked, can you really tell from looking at someone's mouth if they've given a blowjob? His reply was a strong, yes, you definitely can tell, but only if they've really gone after it. Essentially, there are two markers that show up. The first is the more common appearance, which is palatal petechiae, what Dr. Kapadia refers to on TikTok. Palatal petechiae is the clinical term for burst blood vessels on the soft palate of your mouth. You've got your front teeth, hard palate, soft palate further back, and then the uvula hanging down and tonsils on the sides. Basically, pressure from a penis or phallus on the upper back roof of your mouth brings blood to the skin that can cause bruising. The second, less common marker looks more like targeted bruising at the back of the throat. The throat, not the mouth, which may indicate a rougher deep throating session. But couldn't that be something else? Popsicles, a toothbrush really scrubbing back there, a snorkel, or a fiery bong hit? According to the dentist, it would be difficult to definitively diagnose the cause of the injury based solely on appearance. Which I take to mean, unless you tell your dentist that the blowy caused the bruising, they won't know for sure, but they'd have a really confident guess. Palatal petechiae is fairly common, typically observed during a hygiene checkup, and nothing to worry about. In Dr. Rigby's experience, the hygienist will capture a picture of it with an intraoral camera and then give him this sly look or phrase like, is that? And then he'll nod to confirm and move on. If the patient sees the picture and asks what it is, he might say, yeah, that can be caused by a number of things. Violent coughing, sucking through straws, things like that. Just enough to trigger the brain as to what the dentist is alluding to in case talking about sex makes them uncomfortable. So yes, the dentist knows you've been giving blowjobs, but likely won't tell you. Do dentists learn how to navigate all this blowjob detection in dental school? Like how to talk with patients about TMJ disorders and deep throating and palatal petechiae to improve their health? There's a course called Oral Pathology in dentistry school where these topics are addressed quite professionally. According to Dr. Rigby, the words fellatio and cunnilingus are used with the maximum amount of dryness from the professor. This reminds me of my jaw getting stuck open during a teeth cleaning. Not this last one, but before. It was dislocated and I had to manually put it back into place. I explained to my dentist the same thing happened the day before during fellatio because I was concerned that this was going to be an ongoing consequence of oral sex. And he very professionally reassured me that with a little rest, I should be okay. On the Two Bears, One Cave podcast, adult performer Adriana Chechik shared that she had her back molars filed down because she wanted to, quote, be better at deep throat stuff. Dr. Rigby says, if you're constantly causing trauma to your partner, sort through some sexplanations videos and learn from Dr. Doe other ways to give blowjobs. If technique is not the issue, you can ask your dentist to polish your teeth with the phrase, they're very sharp on my tongue. And dentists are a fairly easygoing group who will happily round some sharpness out so long as it doesn't damage your teeth or cause other issues. For the overwhelming and vast majority of people, this is not a problem. But for Chechik, it's her livelihood and her colleagues' genitals. Chechik also shared that she's had to work harder on keeping her teeth healthy in the world of blowjobs. The more acidic saliva in the back of the throat, either from pushing it up or gagging, can destroy the outer layer of teeth called the enamel. Without that shield, teeth are more susceptible to cavities. Tooth decay that creates permanent tiny holes which need to be treated or pulled. How do you take care of your mouth after deep throating? If your partner's semen is healthy, one option is to coat your mouth in it before spitting or swallowing. Semen is alkaline, so it can help neutralize the acidity attacking your teeth. And as the National Institute of Health reports, semen also has many antibacterial agents like lysozyme, lactoferrin, phospholipase, secretory leukocyte protease inhibitors, and seminogellin-1-derived peptides. Or you can mix a little baking soda with water and rinse. Drink a green smoothie or eat a spoonful of almond butter. Think alkaline foods, beets, carrots, broccoli, cucumber, garlic, lettuce, mushrooms, onions. Try not to brush your teeth promptly after oral sex of any kind. Brushing and flossing can irritate and tear the gums, which opens the tissue for pathogens to enter and infect the body. HPV, herpes, syphilis, gonorrhea, chlamydia, Hep A, B, and C, and intestinal pathogens like Giardia and E. coli. Sores from pressure clear up in about 2 days and completely heal in 7 to 10. but the effects of STIs can be lifelong. They can be deadly. STIs don't often have symptoms to alert patients or providers that help is needed. There are 2 sexplanations videos on blowjobs that give you step-by-step instructions on beginner, intermediate, and advanced cheeking, putting a condom on with your mouth, which helps protect you from STIs. That and getting tested so that you know what everyone has, if anything, and everyone gets tested and laid without stress. Testing and treatment goes for periodontal disease and gingivitis too. A final plea from the dentist: if you haven't had your teeth cleaned professionally and taken care of, please do so. Only 58% of adults have seen the dentist in the past year, even though gingivitis and periodontal disease are very common and easily treated. I second that. Make it a date. You and your partner's oral hygiene for better oral sex. See if the dentist can tell what sexual proclivities you've been up to. Stay curious. A big, toothy smile to all of you supporting Sexplanations and Curiosity on Patreon. Even if you don't have the cash to spend, please join us over there for group projects we're working on and sex-positive community. Patreon.com/sexplanations, like these awesome people. I did the sexy teeth further back, and then the uvula. This reminds me of my jaw getting sucked. What? Garlic, lettuce, mushrooms, onions. I'm so hungry. Phosphatidase, lacto, and semen and peptides.